Hello and welcome to GNM 101, an introduction to the 5 biological laws. My name is Dr. Melissa Sell, and I am beyond excited to be sharing this basic information with you today. This German New Medicine and the 5 biological laws has radically changed the way that I work with my own health, with the health of my patients and clients, and I know that it is going to dramatically change the way you see health, the way you see your body, the way you relate to your own psychology and your own biology. And so this presentation is going to serve as a primer, as a basic introduction to you understanding these biological laws of nature. This presentation is based on information published on www.learninggnm.com. We thank the author, Carolyn Markelin, PhD, for her consent to use the GNM material, including the subject-related diagrams, for the production of this video. This information in this presentation is for educational purposes only. It is not intended as a substitute for professional medical advice. So let's get into it. Here is what we are going to learn today. A completely new model for understanding health. The model that we've been working off of, the paradigm of the germ theory of disease and genetics, is outdated. I mean, with things like epigenetics, we know that it's not just what genes you were given that determine your health. We also know that just because certain germs on you doesn't mean that you develop diseases. So those are both theories. They're not laws, and they are outdated, outmoded, and they no longer work for us understanding disease. It's the old medicine. We're going to understand why the body develops what we call disease, and why I also put disease in quotes. In GNM, we really don't even refer to what traditional old school medicine calls disease. We're going to learn how nature works. And this is what I love, is because all of the answers for understanding humanity, they are all hidden and locked away in nature. And for thousands of years, all of the brilliant minds have said, look to nature, look to nature, look to nature. And Dr. Hamer has looked to nature and has seen things in nature that have never been seen before. So we're going to learn a little bit about how nature works. And most importantly, we're going to learn why we never have to fear disease again. The fear of disease eats away at people and literally causes the diseases that people are fearing. And so overcoming fear with knowledge and wisdom and understanding is the greatest defense that you have against developing, what we thought of as diseases. So this understanding will help you to relax, to find ease, to find that peace of mind, because you know now how your body works, and you don't have to be afraid of symptoms and afraid of things going wrong, because you fully understand what's going on in your body. So let's do a little history lesson about where GNM even came from. So Dr. Rike Georg Hamer, he's a German medical doctor he was actually the youngest licensed medical doctor in Germany at the time. He was very innovative. He held several patents on something called the Hamer scalpel. So he was just very forward-thinking, very innovative, and was very into being a medical doctor. And he practiced traditional medicine all throughout the beginning of his career. He had his children. His wife was also a medical doctor, and everything was going great until 1979. And at the time, Dr. Hamer was living in Italy, and his 17-year-old son was shot and killed in a very tragic scenario, and this completely shocked and devastated Dr. Hamer and his family. And so this traumatic loss was followed by 3 months after his son passed away. Dr. Hamer discovered he had a testicular cancer. And being a medical doctor and being healthy his whole life, he knew that this just wasn't random. He had a feeling, he had an idea that this cancer must have had something to do with the tragic loss of his son. And so, like any good doctor with an inquisitive mind, he started making connections and asking questions and interviewing other patients. And so, he had access to a lot of cancer patients, and he started asking them questions. Did you have something happen to you very unexpected? Did something happen before you got diagnosed with cancer? And he started making connections, and he found that without exception, every single person that he had interviewed had some type of trauma, some type of something that happened in their life that was very unexpected and shocking before they had their diagnosis of cancer. And now he didn't just leave it there, because a lot of people have made connections between stress and emotional problems and distress and disease and things like cancer. But he saw something more specific. He was seeing a pattern, and he was very curious. Why does one person develop testicular cancer and another breast cancer and another colon cancer? Why? Is there a reason? Is there a rhyme to why certain people develop certain cancers? And so he, again, took it another step further. Working off of the premise that the brain controls the entire body, Dr. Hammer wanted to see what was going on. Is there anything we can see going on in the brain of these patients? And what he discovered was remarkable, that on CT scan, when he paired together the story of the patient, so the emotional conflict, the trauma they experienced, the type of cancer that they had, he started seeing patterns on CT scan. And the CT scans revealed an activity in a very specific location in the brain, an area of activity based upon what type of cancer. And so Dr. Hammer has linked together an entire science of which cancers are driven from which areas of the brain and which are triggered from certain emotional, biological conflicts. And so I know that's a lot to get through, so we're going to go through a piece at a time. So here's what he discovered. He discovered that everything we now call a disease is originated by an unexpected emotional biological conflict shock. Something that happens to an individual that catches them completely off guard. In GNM, we call this a DHS, a Dirk-Hammer syndrome, in honor of Dr. Hammer's son. So as soon as the DHS occurs, the moment it happens, the person is affected at the levels of their psyche, their brain, and their organ simultaneously. Now, what plays out from there, these diseases, they're not meant to harm or to kill the individual. They are completely understandable. They are reversible. They are meant to facilitate the resolution of whatever the conflict was. It's for your greatest chance of survival. We now call diseases significant biological special programs. I want you to think about it like pressing a button. When the brain interprets, when your subconscious mind, when your psyche interprets a shocking situation, automatically, depending on the type of situation that it was, your body presses a button. And the button sets off a specific program. The button's in the brain, and then it's communicated to the organ exactly what it needs to do to help you to resolve the conflict. And so that is the major premise. And Dr. Hammer has mapped out 5 biological laws. And he calls them laws because it's not just theory. Every single case that he went through, he found that these laws work consistently among every single patient, every single time. And that's what makes it a law. As soon as there is an exception, it's no longer a law, it's a theory. And that's why everything that we have now in modern medicine, it's theory, it's not law, because it doesn't happen across the board every single time. And that's one of the most frustrating things for people when it comes to something like cancer. You see people who, by the book, they do all the right things. They eat all the right foods, they exercise, they do all this right stuff. And so that, by the standard understanding should be perfect. That should prevent them from ever developing cancer. But those people will develop cancer anyways. And then just the opposite. We have people who do everything wrong by the standards, and yet they never develop cancer. And so that's where these theories just kind of throw you for a loop and leave people like you and me, leave the individual in this state of fear, because you can feel like you've done everything right. But because these are theories we're working off of and not laws, we don't really know at the end of the day, and we just kind of hope and cross our fingers and hope it's not going to be us. So with Dr. Hammer and the 5 biological laws, he takes into consideration things that medicine doesn't take into consideration, like the specificity of your unique perception and viewpoint. that is one of the most remarkable things and unique things about GNM and the 5 biological laws is, apart from, even psychiatry, which has its own flaws in the way it looks at things, standard medicine, for the most part, they realize stress is bad, but they don't take into account your personal viewpoint, how you see the world. And Dr. Hamer does. It also ties in evolution, how our bodies got to be where they are now, and embryology. So literally the building blocks that built up went from 2 cells to trillions of cells that are organized and coordinated in absolute perfection. That is you. That is an amazing process. And so he looks at all of these things. He looks at our relationship evolutionarily to microbes, to things like bacteria, to things like fungus, which is so amazing. We'll get to that in this presentation. He also looks at the day-night rhythm, the cycle, just the normal way that humans interact with our environment and the normal cycles of our body. And so he ties it together in such beauty and such perfection, and that is now what we call the 5 biological laws. So let's talk about the first one. Dr. Hamer also calls the first biological law the iron rule of cancer. And for this, there are 3 criteria. The first is that every disease now we're calling significant biological special program originates from the Dirk-Hamer syndrome, the DHS, which is an unexpected, highly acute, and isolating conflict shock that occurs simultaneously in the psyche, the brain, and on the corresponding organ. Secondly, the content of the conflict determines which organ will be affected and from which area of the brain the SBS will be controlled. And then the third criteria. Every SBS runs synchronously on the level of the psyche, the brain, and the organ. So let's get an idea. Let me give you some examples of what this looks like and how it is understood and coordinated. So the psyche, that is where the conflict occurs. That is where you perceive something that has gone on. And so it could be a separation conflict. It could be, a divorce where you're going to be parted from your spouse. It could be a self-devaluation conflict where you're feeling worthless. You lost a sporting event. It could be a nest worry conflict and you're really concerned for the well-being of your child. It could be a death fright conflict where you are really scared that you are going to die, maybe because of a diagnosis, maybe a terrible accident. So that's the psyche level. So there are so many different types of conflicts, and there are so many different types of ways that an individual will interpret a conflict. But as soon as it happens, as soon as it's perceived, the brain, remember I said kind of presses a button, and the button really it's an impact that you see if you look all the way over to the right side and there are arrows around these circles. Those circles are something we call a Hamer focus, which Dr. Hamer's colleagues originally made that name up as a joke because they would tell him, oh, this is just an artifact. This is not, this isn't anything at all. That's just a blurry image that'll appear on a CT scan. And Dr. Hamer actually confirmed with Siemens, the CT scan developer, that these images that you see, these impacts, these Hamer focus in the brain on the CT scan is not an artifact, that it is a delineated area of activity in the brain. And so from there, the brain, it sets into motion on the organ level a very specific set of responses. And so here are some more examples of the psyche-brain-organ correlation. So again, I mentioned the nest worry conflict. And so let me give you an example. So nest worry conflict could be a mother standing on the sidewalk holding her child's hand. The child sees a dog across the street, darts away from her mother, runs out into the street, and a car comes by and hits the child. In that moment, the mother has a conflict shock. This unexpected thing happened. She wasn't prepared for it. And all of a sudden, she sets into motion from the area of the cerebellar mesoderm. The motion is set for the glands of the breast to proliferate and form additional breast gland cells for a purpose. And the purpose is for the nourishment and the healing of her offspring that she is so gravely concerned about. And so in that moment, the body starts proliferating breast gland tissue. And this is regardless of whether or not the woman is lactating, the age of the woman. This is a built-in, deep down biological program that's programmed into every woman. Now, even down to the level of understanding whether it's the right or the left breast, Dr. Hammer has an explanation based on biology, based on handedness, because a right-handed woman, because she's right-handed, she biologically associates her left side with her child, because a right-handed woman holds a child with her left arm. And so her left breast will immediately start to proliferate breast gland cells. Now, the moment that the child turns out to be fine, goes to the doctor and everything's fine, the body starts to break down that breast gland tumor. Again, we'll get more into all of the details. I'm just trying to get that basic pattern so that you start to understand what's actually going on, that the body's there's not an error. This is designed, this is programmed, this is based on evolution. This is for the child's greatest survival, for the propagation of the species. So your body, it knows how to survive, and it knows how to best have your offspring survive, how to best make sure that you are reproducing so that you even have offspring. Another example is an indigestible morsel conflict. And so something that you'll start to understand and you'll start to see is that this is something we have in common with every species, every animal, because animals, they experience these conflicts in real terms. And in our course of evolution, there was a point at which we experienced all of these conflicts in a very real way. Like an indigestible morsel would be like an animal biting off, swallowing a bone that can't be digested. And so the body has to have a plan for that. And the plan for that, which is mediated by the brainstem, is to produce a digestive system tumor. So for example, the duodenum, if there is a bone fragment stuck in the duodenum, it will begin to proliferate additional cells. And the purpose of these additional cells is additional digestive gastric juices to break down this indigestible morsel. Now, humans, we don't typically, swallow pieces of bones. I mean, we can, but more likely we will experience an indigestible morsel conflict in a transposed way, in a psychological way, in an emotional way. Say a piece of news that you just can't digest, something, happened and you hear about it and you just cannot accept it. This is an indigestible morsel for you in that moment. And so your body will set off that program as long as you are active with the conflict, as long as you are just milling about it and you're upset about it and you just can't believe it, and your body is programmed to help you in this way. It is seeking to assist you in breaking down this indigestible morsel by causing a tumor of additional stomach cells, duodenal cells, rectal, all of these tumors of the digestive tract come from this concept of an indigestible morsel. Death-fright conflict has to do with the brainstem, has to do with lung cancer. So lung cancer is very commonly a secondary cancer, and it's thought in traditional medicine that it is a metastasis, so you have a cancer in the breast or in the prostate, and the theory in medicine is that pieces of this tumor break off and they go and they get in the lung, and then they cause a lung tumor. And it's just, they think that the cancer is there just to take over your body, to spread and divide and conquer and kill the organism, when that is not the case at all whatsoever. The lung cancer is there because your body experienced perhaps a diagnosis as a death fright, as a shocking death fright, concern for your very existence. And so your body starts to proliferate lung cells, alveoli cells, so that there is greater surface area for the absorption of oxygen, which is, again, that's so tightly knit to us being alive, is breathing. And so your body is helping you to breathe. And you can see the connections with all of these different types of conflicts. And there are very detailed maps and ways of understanding exactly what's going on at every stage of the process. So again, psyche, brain, organ, your subjective mind. It's how your mind chose to perceive the situation. Unique to you. It's as unique as your fingerprint. Everything about who you are determines how you see the world and how you interpret scenarios. This is a subconscious and a subliminal interpretation. We know from neuroscience that your brain actually makes an assessment of a situation 6 to 10 seconds before your conscious mind is even aware of it. And so your brain has already pushed the button. It's already made up its mind by the time you have interpreted that I'm upset about this, I'm concerned about this, I'm worried about this. Your body has already set into motion this program. And this even begins as soon as you have a consciousness, as soon as you have an awareness, even as a fetus. You can be impacted, and that's how children can be born with what we perceive as problems. It's because it began while the child was in utero. Now, again, the moment of the DHS, there is a focus of activity in a predetermined area of the brain. And this is so interesting, and we'll get into the embryology aspect and the evolution aspect. These predetermined areas of the brain, they're mapped out and they're based on evolution. So when organisms were just, a single loop with one hole for the in and the out, which is very, very interesting. Before we even had like a mouth and an anus, there was just a tube and there was one hole that everything came out of. And so your brain is mapped in a very particular way based on that in and out format from very, very early on evolutionary forms. And so the predetermined areas of the brain are fascinating. The focus of activity can be identified on a CT brain scan as a concentric ring configuration called the Hammer focus. And the location depends on the nature of the conflict. As soon as a Hammer focus occurs on the brain level, as soon as that button is pushed, the organ associated with that area undergoes a functional change. And the functional change is meant to facilitate the resolution of the problem, meant to help you. So it could be a growth, it could be additional cells. It could also be tissue loss or tissue ulceration. Or it could be a functional loss where the cell or tissue type is no longer producing a certain thing that it normally produces. So, being human, come on, how many different types of potential conflict shocks are there? Just think about all of the things you've experienced in your life. There are refugee conflicts for people who are literal, actual refugees, or, say there was a hurricane and their home got destroyed and you feel like a refugee, you have nowhere to go. That's a conflict. Isolation, let's say you you have an accident or you have a diagnosis and you are left in the hospital and you're feeling isolated and separated from the pack, and that's scary for you. Being too slow. If you were too slow to meet a deadline and you lost your job or you didn't get a promotion. If you were insulted, if, that indigestible morsel conflict, if you're feeling ugly, if you're devaluing yourself, if you've lost someone, if you've had a death in your family, if you've lost a pet, if you've had some type of abuse, some type of, sexual dysfunction or sexual problem or abuse, some kind of anger, if you're afraid, if you're feeling attacked, if you're feeling disfigured, if you, were inappropriately touched, if if your territory is being taken away, if you're a child and your parent has a new child, you could interpret that in so many different ways. And so the potential for different types of conflict shocks is really endless. And you think about humans and how we respond to things. And that's why one of the best forms of prevention is self-knowledge and self-awareness and this resilient ability to assess your situations that you're in and choose how you want to respond rather than reflexively responding. So your subjective assessment, it depends on you. It depends on what you've been through, your past experiences, what is important to you. What do you believe about the world? What do you believe about yourself? What do you believe about other people? How have you been conditioned socially, culturally? What's going on in your world, in your life? What are you afraid of? What makes you feel vulnerable? Your individual perception is so unique, and that's why disease is so unique, or specific biological special programs that get set off in you are very unique and will not seem the same to another individual. So your individual perspective. you may experience the same objective life events. This happened, that happened, there was a divorce, there was a death, financial problems, hospitalization, but your interpretation of the subject can vary so much. So let's say objectively there was a divorce, and so you're a female and you find out that your husband's leaving you and you have to get a divorce. And so you could experience that as a separation conflict where you feel as though your spouse has been torn from your breast and you're not going to physically be able to be near them and touch them anymore. Your body could interpret that in a way that affects your breast ducts. You could feel abandoned by your spouse, which would affect your kidney collecting tubule. You could be angry and so mad about the fact that this happened, which would affect your coronary artery. It could be a starvation conflict and you're worried about how you're going to provide for yourself, or if you have children, and that would affect your liver. And so the specific type of biological program that is set off by something like a divorce is you just don't know until the symptoms show up, until you discover how your body chose to interpret that scenario. And that's why I love GNM and the 5 biological laws, because you get to know yourself on such a deep subconscious level, on a level that most people would never know how their subconscious mind interpreted a scenario until after the fact, until learning yourself and how you uniquely see the world. Now the second biological law. Now this one is so cool, and you will know right away once we go through this. You will have experienced both of these phases of the second biological law, which says that every significant biological special program, remember that's what we used to call disease, we now know it's a special program that's designed and adapted and perfect for this scenario, runs in 2 phases, provided that you've resolved whatever the original conflict was. So this is the beautiful chart that Dr. Hammer has mapped out about the 2-phase pattern. And this is just an absolutely remarkable discovery and map for understanding what goes on in the disease state. So I want you to see the beginning of the chart where it says day phase sympatheticotonia and then night phase vagotonia. So in a normal rhythm, think of a pendulum, back and forth, day and night. In the daytime, you're more sympathetic active, which is your fight or flight nervous system. The sympathetic system is more active. And then past 5 p.m. in the evening, if you've got this normal day-night rhythm, you're more vagotonic, which is the parasympathetic, the rest and digest. And that's just normal. We should have day and then night, pendulum, back and forth. Now at the moment of the DHS, as soon as the conflict, the unexpected, shocking thing happens, the normal day-night rhythm is interrupted. And then the pendulum swings all the way to the sympathetic side. And so you are in the conflict active phase. And so you stay there for a period of time. We'll talk about the symptoms of the conflict active phase in a moment. But then when you resolve the conflict, it's over. You've resolved it. You've made peace. Now the body goes into a healing phase. During the first half of the healing phase, PCLA, this is where there is a lot of fluid in the area. There's swelling, there's exudate, there's just edema, there's pain, there's discomfort. And that goes on until the pendulum gets all the way to the complete vagotonia, like as much vagotonia as possible is swollen to the area. And then there's something that happens called the epileptoid crisis. See that arrow that points straight up and is blue again? That represents a turning point of the healing program. And so for a moment, for a brief period of time, not even just a moment, it's a brief period, the body goes back into sympathetic and it squeezes out. And this is where there'll be an event, some type of health event, like a heart attack, like a migraine attack, like a seizure, like muscle cramp. Something happens in the body, and the body starts to squeeze all of the edema out. And then it gets to the second phase of healing, which is scarring, and then the body gets back into that rhythm after a period of time. And so this is a beautiful, such an amazing map. And let's go into the specifics of what happens during each phase. Conflict active phase. This we also call the cold phase. So this is when you are in prolonged sympathetic dominance. Cold hands, cold feet, shivering, fast heartbeat, high blood pressure, you're nervous, you're restless, you can't eat, you can't sleep, you're compulsively thinking. This is after that conflict happened, after you got the news, after you got the phone call, after you got the diagnosis, after you found out about the whatever. This is your psyche is in compulsive thinking mode. It is, you're not sleeping because your body wants you to resolve the situation. So it won't let you sleep all night. You wake up at 3 a.m., you're restless, you're worried, just like your mind is going a mile a minute, and you have not resolved the conflict yet. And so at that moment, that's when there's this sharp ring formation in the brain area, and then the organ is undergoing those changes. It happens immediately. It happens before you're even aware of it. Your body has pressed that button, and the program has been set into motion. And now, conflict activity. Again, it's adapted, it's a beautiful system, it works great, but it's not meant to work for a very long period of time. And so that's why the coaching and the help that I give people with G&M counseling, with helping them with these problems, we've got to keep these conflict activity periods as short as possible, because it's not that they won't happen. They will happen. I still have conflict active periods, but your ability to recognize that you're conflict active and to actively resolve situations quickly is going to serve you so well over your lifetime. And we want to get to a conflict resolution as soon as possible. So there are many possible resolutions to whatever conflict you are experiencing. The best kind is a natural resolution. So, if you were terrified that you lost your purse and you lost your keys and your phone and your all of your stuff, your purse is just gone. And that is like a conflict activity period. The best resolution is a natural resolution where you find your purse and you have all of your things again, and then you can be totally at ease. If that's not the case, and if it actually is gone, you downgrading the intensity. And so talking yourself down and realizing that all of those things are replaceable and everything is okay. And, sometimes, talking with someone, emotionally releasing yourself from this concern, realizing you'll be able to take care of all of it, that there are things, in place to, cancel the credit cards and replace the phone, and everything is okay. And so what was a really awful situation, can be downgraded, and it doesn't have to prolong for very long. I know this is a very, specific situation with the purse being lost, but, thinking in whatever terms that you are having a problem with something, think about downgrading it, emotionally releasing, forgiving another person, forgiving yourself, trying on a new perspective, understanding other people. So if it's a scenario with somebody else that you feel like has done something that you don't agree with and that you're really upset about, understanding that, they're doing the best for themselves in their life. Maybe your priorities shift, so let's say you lost your purse, but then you found out you won $10 million with the lottery ticket in your pocket. So you're not as concerned because no longer is your priority on that lost bag. And then you're just seeing the bigger picture, taking a new perspective. And that's why, there are so many different approaches to limiting your conflicts that you have and downgrading them and feeling better faster. So after you've resolved your conflict, there is a consequence to having been in a conflict active phase. Your body was doing something, your body was in an adaptive state for a period of time when it was in prolonged sympathetic mode. There were additional cells that were built up. There were cells that were eroded away depending on the conflict. So there was a lot going on. You didn't have any symptoms because your body's like, they don't have time to have symptoms right now. It doesn't even matter. We're willing to sacrifice tissue. We're willing to build up new tissue. We're willing to do whatever it takes to help them resolve this conflict because we want to survive to see another day. And so that's at what level your brain is thinking and your body is thinking. It's like, it's all about survival. It may just be a lost purse, but your body is like, we've got to rally all of our resources behind helping her solve this conflict. And so, that may mean eroding the lining of your arteries going to your heart so that you can have more blood and more, power to overcome this situation. It could mean your body, turning off your beta cells of your pancreas so you stop making insulin, so you've got a lot of sugar in your blood so that you have a lot of energy so that you can resolve this situation. So you can see the body is doing you a favor, but it's meant to just be for a brief period of time. but then you need to heal. And so your body has to go through a restoration period after you've been conflict active. It's how it happens. It's rhythm. It's the pendulum. It's how it must occur. And so the healing phase, this is the warm phase, and there are 2 phases to it. So this is post-conflictolysis. So after the conflict is resolved, portion A, so the first half. So this is prolonged parasympathetic dominance. You've got warm hands, you've got a fever. Night sweats are a very specific thing that happens if you have a TB-related growth or a TB-related tumor. Certain tumors, when they build up, tubercular bacteria will break them down. There'll be very particular night sweats, an odor to your body, even if it's a digestive cancer that's being broken down by TB. There'll be especially a certain way of smelling in the bowel movement, because it's all getting out. Your body is getting it out. It's sweating it out. It's healing the body. There's fatigue. You're really tired. There's pain. The pain comes from the swelling. All healing happens in a fluid environment, and so there's swelling on the organ level, and there's also swelling on the brain level. Because remember, your brain is affected as much as your organ is affected. There's that impact area of the brain. And so fluid rushes in there as well to heal. And fluid rushes into the organ to heal, whether it's the breast, the digestive system, the skin. There's going to be swelling. You're hungry again, so you're gaining weight. You've got a slow pulse. Your blood pressure's low. You just can't get out of bed. You're inflamed. And so this is so important that you let your body heal, that you do the rest, that you take the time, and you let your body do what it needs to do. On the psyche level, you've resolved the problem. You're feeling pretty good. You're in a state of relief. You're kind of disappointed that you're sick. If you don't understand the new medicine, you don't know that this is a normal and proper function of the body. And so you're in a state of relief, but now, you're not feeling too hot. On the brain level, there, again, like I said, there was fluid that has rushed into the area of the brain. And so there's brain edema. So there's symptoms of that. There's dizziness. There's a dull headache because there's an increase of the intracranial pressure because of the fluid. On the organ level, it's a construction site. So there's tissue being broken down, tumors being broken down. Sometimes they'll be bleeding because there's small capillaries that build around tumors. And all of this needs to be broken down because it's your body returning to normal. And the intensity of this phase will depend on the intensity of the conflict. And so there are minor things that happen all the time. So let's say you're just you're fed up with something going on at your house, and you're just you go through an hour or two of just being really just frustrated and upset and just angry and fed up about something. And this may induce a cold because the program of being just fed up, just full. In German, it's a phrase that's like, my nose is full. Like, this stinks. Like, you're just like, this sucks. This stinks. And so your body, what it does when you're conflict active with that, will erode the lining of your nose because it wants to sniff out. It wants to get rid of this problem. And then the body, when it's repairing, you are stuffed up. You have a head cold because you were healing from a stink conflict, from something that just stunk, that you're just upset about. And it was just, you were sniffing it out. And so your body did something. And so if that was just a minor thing, it didn't last very long, it'll be a minor conflict. You'll have a head cold for a few days, what you call a head cold. And again, we think it's germs. We think it was a germ that got on us, and now we've got this germ. But really, it was something going on psychologically, something that affected you in this way that caused your body to respond with the proliferation of new tissue cells, of swelling in the nose. All right, so let's talk about the epileptoid crisis. This is such a fascinating portion of the healing program, and this is designed specifically to squeeze out the edema. You can only handle so much swelling in an area before we've got to turn the corner. And in order to turn the corner, the body induces this surge of sympathetic dominance. And so this is, just think of it as that pendulum has made it all the way over as far as it can go into parasympathetic, and something needs to get it going back the other way. And that's what this episode is. So depending on the conflict program, depending on what it was, it could be all sorts of different things. The middle of the night coughing fit, it could be a stroke, a migraine attack, a heart attack, diarrhea, all sorts of different things. And when the epileptoid crisis typically will strike, when it will happen, will be during a time of rest, because again, it's going to likely be at night or in the very early hours of the morning when your body is totally relaxed, because that is that point at which the greatest swelling has made it to the area during relaxation, a vacation. And then the extent, so how severe this epileptoid crisis is going to be will depend on how bad the conflict was. Again, how long it went on, how intense it was. And so this may be a very intense situation. And so it's actually very important to work with someone if you are worried, if you've been conflict active for a long time, if you've had an ongoing problem that's been years and years and years, you want to talk with someone before you just kind of go and clear up the problem and like fix the problem, resolve the conflict, because there are some very potentially, possibly even fatal epileptoid crises that can happen if you've been conflict active for an extremely long period of time. And you might, I find it so interesting that actually some things are better off not being resolved. And so if you've suffered a certain type of conflict, it's actually good to kind of get mad about it every now and then, and to kind of keep it active in your mind, because if you were to try to heal and completely resolve it, the healing fallout, the healing crisis that you would have may actually be fatal. So just kind of caution here. Don't worry about it. Just kind of like say, oh, isn't that very interesting? If you've had something that's been going on for 9 months or more, definitely talk to someone, and there are ways to mitigate the effects. And so, in German New Medicine, modern medicine is very useful at times. If you during a healing crisis have experienced an extreme bleed, and so because of the nature of the small capillaries and the breaking of the capillaries during the healing process and the swelling, you may lose a lot of blood. And so definitely, if you are experiencing a lot of bleeding, get to the hospital so you can have a transfusion so that you will make it through this healing crisis. So medicine has a very important role to play, modern medicine, in supporting your healing process. And so that's all it is. It's a supportive process. You do want to be cautious about medications, because most medications that are used, what happens is it takes you out of this parasympathetic vagotonic state where you're symptomatic, and what the chemicals of the pharmaceuticals do is actually puts your body physiologically back into the sympathetic atonia state. So you're not feeling pain anymore, and you're like, woohoo, I feel great. But if you want to heal, you actually need to go through the course of the healing. And there are ways to lessen the pain and to mitigate some of these effects. But some of them you're just going to have to go through without the aiding of medication, because the medication doesn't just numb you. It changes your physiology. It changes what your body's doing. So, you're reliving the conflict physiologically. The body's squeezing out the edema. It's happening on the brain level too, so you just might get this like splitting headache, which is the brain squeezing the edema out. And then you go through a urinary phase, because again, you just squeezed out a bunch of edema. It's got to go out. On the organ level, there's spasms, muscle cramps. You'll see that in the heart attack. It's actually muscle cramping to squeeze out edema. Very interesting. All right, so now we're to the second half. We made it through the epileptoid crisis, and so now you're still in the healing phase, but you're on the other side of it. And even it's kind of like old wives' knowledge of like country doctors. They know, like, oh, if they make it through tonight, they'll be just fine. If they make it through tonight, they'll be just fine. That's what this is. That is, a colloquial experience of this very profound thing going on physiologically. Is like, oh, well, we've experienced this a ton of times. If they make it through this rough night, this coughing spell, whatever this is, we know they'll be just fine. And we know that because they've made it to the second phase of healing, which is where new collagen is going to be made by fibroblasts. You're just relaxed all over, warm extremities. And so your body is healing. You've got a feeling of well-being. And so this is such a a wonderful phase to be in because you've made it. Depending on if you know the new medicine, if you still are living in the model of the old medicine, the epileptoid crisis probably freaked you out. If you had something happen and you probably got rushed to the ER, you might be relapsing back into a conflict activity and not finishing your healing process, which is such an important thing to be aware of. So people that end up with chronic conditions, it's because they never finish healing and they keep relapsing back, and they go back into the hospital and they're isolated again, and they're scared again, and they're worried again. And so they're back in conflict activity, and they're being given a bunch of medication. And so they never make it to this phase. And so that's why the more people that know about the new medicine, the more people that know the 5 biological laws, and they are at ease and they understand, I'm going to go through something. I might need a little bit of help to get through it, but when I'm on the other end of it, my body is doing what it needs to do. Okay, another thing that happens here is on the brain level. And so the glial cells of your brain are like the connective tissue. They come in, there's more glial cells than there are even actual like neurons. The glial cells are the supportive tissue. And so they are proliferating during this phase. And it may be diagnosed as a glioblastoma, which is glial cells proliferating. But this is not a tumor. This is not something that needs to be gone in and removed. This is a restoration area. This is the area that was impacted by the DHS being restored. And then on the CT scan, you'll see this white glial ring. This is a good thing. This is the body healing. The organ is being restored. There's scar formation. If it was something that impacted your bones are remineralizing and they're stronger than they were before. Okay, so let's go on to the 3rd biological law. This one is, again, so interesting. This is the compass of German new medicine is encompassed in the 3rd biological law. This is the ontogenetic system of cancer and cancer equivalents. So this is basically an understanding of where certain cell types come from and what type of biological program they will perform. So it's got to do with embryology, and I love this quote from Dr. Hammer. The medical textbooks of the future will no longer assign diseases to special disciplines, but they will instead categorize them according to their embryonic germ layer relation. The new medicine offers a reliable scientific system that allows a classification of diseases in line with embryological aspects. So I do remember when I was going through embryology, I loved it, and it's so fascinating, but it's so complex. It's just remarkable how we went from 2 cells to what we are now. It's like the most profound magic that seems so mundane because people have babies all the time, and it's just something we're immersed in life. And so, but when you look at the details of it, it's just remarkable that this is how you were formed. This is how your body came to be what it is now. On the left here, you see the endoderm. So the endoderm is the yellow, and so that is everything from the mouth to the rectum. That is the alimentary canal, and it is the oldest. It's the oldest tissue, and so that's the brainstem. The old mesoderm. So the old mesoderm has to do with your certain connective tissue of your dermis and your pleura, so your protective areas having to do with your cerebellum. The new mesoderm is bones and ligaments and tendons that comes from the central medulla, and then the ectoderm is the new brain, which is your epidermis. So we're going to go through each of these levels and understand and talk about what's going on. So the endoderm. So the endoderm is the oldest brain. This is primal. Think, evolutionarily, these are like the ancient of the ancient creatures. The oldest germ layer, we also call this the reptilian brain because, again, it's the oldest brain. And this is what forms your most basic functions. So think of just like a basic being that doesn't have higher thought, that just bees. What does it do? It breathes, it eats, and it reproduces. That's what it needs to do. And so the oldest conflict types, like the most basic built into conflict types, are death-fright conflict, so that has to do with breathing, a morsel conflict having to do with food and eating, and then a procreation conflict having to do with reproduction. And what Dr. Hammer found was that all endodermally derived tissues, so that's the cool thing, is like when you're just these two cells and then you become this blastocyst as your cells are coming together, and you've got all these cells that are forming, and then you've got this neural tube, and then you've got these 3 germ layers, these 3 basic layers that fold together and they turn into all of your complex organs. And so the endodermally derived tissues will all behave in this certain pattern, in this certain way. And so all endodermally derived tissues in the conflict active phase, when you're freaked out, when you're worried, when you're scared, these tissues will proliferate. These are the ones that will have tumors. These will have growths. And so that's why there are lung tumors, lung growths, there are digestive system tumors, growths, and then, like breast gland tumors, prostate, things like that. And so during the conflict active, cells are proliferating. During the healing phase, there is tumor breakdown. There is a very specific way that the body is designed and programmed to break down tumors. So let's give an example. Indigestible morsel cancer. This is an endodermally derived tissue coming from the brainstem. So the conflict is not being able to digest a morsel. We gave an example of that earlier. An animal would bite off a bone too much. We could be angry about something concerning a family member, something concerning money. You're just a situation that you just cannot digest. So during the conflict active phase, the body is going to proliferate secretory cells to increase gastric juices to better digest an unwanted morsel. That's what it is. It's not trying to eat you from the inside out. It's not there to kill you. It's there to help you. It's helping you to digest this indigestible morsel. So let's move on to the mesoderm. We did endoderm, now mesoderm. And so there are 2 types of mesoderm. There is the old and the young. So this is the midbrain. So this is the mammalian brain. This is the limbic brain. And this has to do with protection and support. So again, think about evolution of creatures. So we have basic functions. Now we want a little more protection. And so the old mesoderm forms the breast glands, the dermis, the pleura, the peritoneum, the pericardium. These are all protection organs. So they have to do with, guess what? Attack conflict. So if you're feeling attacked, if you are feeling also soiled conflict, and so again, this could be actual physical attack, someone slaps your face, or it could be a verbal attack. It could be, you really feel attacked, someone's like saying all kinds of mean things to you and you're feeling attacked in that way. This can cause things like acne. And so during the conflict active phase, there is cellular proliferation. And so the cells are building up. Why? To protect you even further. And during the healing phase, those cells are then broken down. Now, the young mesoderm is the striated muscles, the bones, the tendons, ligaments, and connective tissue. So these have to do with self-devaluation conflicts. So this is kind of like your structure. And if you start to doubt yourself, if you're feeling not smart enough, not good enough, unworthy, all of these things interpret in your body as, wow, we are devaluing our actual makeup. And so the bones during the conflict active phase, they break down. So like osteoporosis, there'll be breakdown and erosion of certain areas of muscles, bones, tendons, ligaments. Again, it all depends on the specific type of conflict. And the purpose is afterwards, if you've ever broken a bone, you know that afterwards that bone is the strongest bone in your body, whichever one was broken. Because after there's been a devaluation, after there's been a breakdown, the body comes in and makes it stronger than before. So here are the examples. Old mesodermal derived tissue, cerebellum. We've talked about this one a couple times already with the nest worry conflict. So you've got this extreme concern for the well-being of a loved one. The breasts, they symbolize care and nurture. So this conflict doesn't have to be about your child. It could be about your parent, a pet, just another loved one, a friend. It could be about your home. It could be, worry regarding an argument you had. It's something that you just have this just extreme concern for the well-being. of someone. And so during the conflict active phase, there are proliferation of the milk-producing cells to provide more milk to speed up the healing of a loved one. Because breast milk, if you are not aware, is absolutely brilliant. It does so much. If your offspring, if your child is born premature, it changes its composition. If your child has a fever, it changes its composition. If you're depending on what your baby needs, your breast milk will change accordingly, because the body is so smart and it knows exactly what to do and exactly what that offspring needs. And so again, this is such a deep ingrained biological program that this is at work all of the time, whether or not you're breastfeeding. So a self-devaluation conflict. So this is the other mesodermal tissue, the young or the new mesoderm. And this is in the location of the brain of the cerebral medulla. So the conflict is a self-devaluation. So examples are like, I'll never succeed, I'm a failure, you're humiliated, you feel, if you've been abused, if you've lost your status, lost a job. The bones of your body, they literally start to demineralize. And so the biological purpose is, once the problem has been resolved, you are stronger, you are reinforced, you are more resilient afterwards. And so we want to get to that afterwards as soon as possible. Now the ectoderm. So this is the new brain. This is the newest evolutionarily. So this is the kind of the human brain. What makes us human? Our cerebral cortex. And so it's got more to do with social contracts. Things that we worry about now that we've got this bigger brain that has more things to think about. And so the cerebral cortex, the ectoderm layer, goes on to create the lining of the bile ducts, the pancreatic ducts, the milk ducts, the cervix, the bronchial tubes, heart vessels, and then the epidermal layer, so your outer layer of skin. So this has to do with more advanced conflicts. Things like separation conflicts, sexual conflicts, territorial conflicts. And during the conflict activity, so when you're upset, when the problem's going on, when it's active, there is cell ulceration. And during the healing phase, there is cell restoration. So there's less cells during the conflict activity because, again, this is meant to help you during this scenario. The loss of cells has a very specific meaning. And then after healing, your body wants to restore. Okay, so we're going to cover a ectodermally derived tissue conflict. And so this is very interesting because the last example we gave was of the breast glands and how that has to do with the nest-worry conflict. And remember, the breast glands are old mesoderm derived tissue, which behaves like endoderm, so there's cell proliferation during the conflict active phase. Now, the separation conflict involved in this particular type of ectodermal tissue is the ectodermal tissue of the breast ducts. And so the breast ducts are aligned with ectoderm, and that is controlled from the cerebrum. And so this conflict of separation, think of the phrase torn from my breast. So what happens if you have a separation conflict where, and this again doesn't have to be a child, it could be a partner, it could be a pet that maybe got hit by a car or something and you just like lost them all of a sudden, and just you had this separation conflict where you won't have contact any longer with this person, this being, this thing that you loved. So in nature, again, we got to think of this in the natural sense. In nature, if a mother loses her offspring, the breast ducts, so you lose this child that you were prepared to have, whether, I guess this can even happen during a miscarriage, or if you a stillbirth, or like a child that dies very early on. So the breast milk has been built up in the breast glands, depending again at the age of the child that it was lost. But again, even in theory, the breast ducts are still going to respond in this way. Even if you're not lactating, even if you're not breastfeeding, your breast ducts will still respond in this way because it's a pattern of behavior that's programmed into the breast ducts. The emotion perceived by the psyche is this torn from my breast separation conflict. The breast ducts will erode during the conflict activity, and that is to siphon off the built up milk to prevent any blockage of milk getting stuck in the canal because of the fact that there's no baby to have the milk. And so ductal cancers, so during the conflict activity, the cells of the breast duct are eroding, and you can't really even feel that. There are no symptoms during the conflict activity. The body is just responding. The body is responding by widening the duct. And you can even see that image in the middle. The top is the normal duct. So you've got normal everyday duct, then there's separation conflict. There is an impact in the area of the cerebrum, and then it is communicated to the breast duct to erode immediately. And so just imagine a stage between those two where that normal duct, those cells are starting to erode and they're widening. And the purpose of that, again, is to siphon off the milk so that there's plenty of space for it to dump off and not get stuck in the breast. And so now, as soon as the conflict is resolved, however the person, is resolving that conflict, immediately the cells will start to regenerate. And think of it almost like a scab. It's a healing cancer. So a ductal carcinoma, and they'll say, oh, this is an invasive ductal carcinoma. All that means is that the conflict activity had gone on for a long time or was extremely intense. And so basically there's big gapping holes in the breast duct because of the erosion. And now the body has to fill it in. And so the extent of that cancer that you see blocking off here now, that is a scab. That is exactly doing specifically what it's supposed to do. It's cellular restoration. And so when you feel a tumor in this stage, this tumor will be experienced, it's already in healing. And so if there is a ductal cancer that you've got, that is totally okay. It's the body healing, and it is doing exactly what it's supposed to do. It's the fear. It's that fear of discovering a lump or going in for a mammogram and having this discovery and you finding out that it's breast cancer. That is the biggest danger of this type of cancer, is the fear associated with it. Because in all likelihood, women have experienced all sorts of cancers that are there, they heal, they go away. Because the body is programmed for this. It's designed for this. It's what happens if it's left alone. But we've got this hypersensitive world of making sure that everyone is getting mammograms, and we're checking and we're hyperactive, like looking for these things, but we are not understanding how they get there. And so we've got this society that's all about early detection, but we don't understand why it's even there to begin with. And so we've got this misinterpretation. We get really scared. We try to take action before, when really if it was just, and I'm not saying do nothing. And so that's one thing I do want to make very clear in GNM and understanding the 5 biological laws. It's not about doing nothing. It's about understanding and having proper guidance and coaching through this process so that you are making informed decisions. You're not making decisions out of fear. You're not cutting away parts of your breast that are actually healing you, that are doing exactly what they're supposed to do. And so that's why it's all about ease. It's all about relaxation. It's all about realizing what your body is doing, being prepared for the healing symptoms, and everything that goes along with that. So this is an example of an ectodermal conflict regarding separation and the breast ducts. And so that kind of wraps it up for the just examples I wanted to give of each different type of tissue and each different type of conflict. All right, on to the 4th biological law. This one is the ontogenetic system of microbes. I love this law because I am very pro-bacteria. I'm really into probiotics and sauerkraut, and this was kind of one of these big health revolutions for me, was just starting to get all of these good bacteria and making my own sauerkraut. I was really into it because it just makes sense to me that our body is mostly bacteria. And when you think about bacteria, we think about bugs, but really it's such a part of us. And bacteria are actually instructed by our brain. Your brain tells your bacteria what to do and when to do it. And so what Dr. Hamer discovered is that germs, microbes are there, bacteria are there for our help. They help us all of the time. We co-evolved together. We didn't evolve separately from microbes. We didn't evolve in sterile hospital rooms. We evolved literally up against, entwined with every aspect of nature. And so just as fungus break down decaying wood in the forest, fungus in our bodies break down tumors for us. Bacteria like TB bacteria are some of the oldest bacteria. And so they literally work to break down tumors in our bodies. They are there for our help. They are not there to hurt us. And they're there all the time, but they're seasonal workers. The bacteria are only active when they are needed, when the brain instructs them to activate. And so it's when they are needed to break down the results of a conflict phase. So there was a conflict, then there was a resolution, and now, okay, call up the bacteria. They need to become active now so that they can do what they need to do. And so diseases are not contagious. The bacteria and the fungus that are present, they've gotten the blame. They've gotten the blame for being responsible for the head cold, for the flu, for the this, for the that. We do a swab and we say, oh, look this here is what caused it, when that's not the case at all whatsoever. It's like saying that the fire truck caused the fire, saying that the flies caused the garbage. No, they're there because they're part of the cleanup crew. They're part of fixing the problem. And so that's what I find just so, I like to vindicate the bacteria and the fungus of the world for people thinking that they're the cause of disease when they're not at all whatsoever. And this is another thing to show you that diseases are not contagious. The germ theory is not the proper model. If a germ gets on a person, they could be totally fine because they're not conflict active and their body isn't using that bacteria to help with the healing process. And Dr. Hamer found that specifically with endodermal tissues, again, endoderm, oldest tissue, fungi, mycobacteria like tuberculosis works with that old tissue. The mesoderm will be other types of bacteria like streptococcus, staphylococcus, is used on the mesoderm. And now the ectoderm, it's bacteria, and then viruses, if they even exist, because there is a very interesting, and I'll do a workshop about this as well, about viruses, and there are no electron microscope pictures of viruses. There, when we say, oh, we've isolated a virus, really what we've isolated is what the body is doing. It's a very specific, response, something that's happening in the body. And it's not actually it can't be isolated. And so the fact that it can't be isolated and then put on someone to cause the exact same disease, that's part of the scientific process. And that cannot be reproduced in viruses. And so that's why there's a lot of question about whether viruses, if they exist, and if they do, they're there to help, and they help during the healing process. And that's why they show up when a person is symptomatic. Okay. The fifth biological law, this is just the quintessence. This is the pinnacle, the ultimate, the fact that disease is not an error. Your body is not making a mistake. It's not messing up. It's not screwing up. It is doing everything evolutionarily, biologically, embryologically perfect. It evolved over millions of years. These biological special programs, while they don't make sense to us anymore because we've evolved mentally so far beyond needing, these things to break down. We don't need necessarily additional stomach lining cells to break down the anger morsel conflict that we have with our spouse. It's not functional for us anymore, but it's doing something for us, for our benefit. It was, just thinking about this, how you got to now, it's like, wow, thank you, body. I realize that I don't actually need this stomach tumor, but it's taught me a lot about myself. It's taught me a lot about my relationships. It's taught me a lot about how I interpret situations. And now I've got this greater self-awareness and self-knowledge and self-understanding. And now the next time I encounter a situation, I'm going to handle it differently because I know that if I handle it in the same way, my body's going to have that same response. And so I just think that's a beautiful, beautiful, wonderful thing to have access to this knowledge. In Spanish, German New Medicine is called the sacred medicine, La Medicina Sagrada, which I just think is beautiful. And I do see it that way. I see this as a sacred beautiful understanding of how the human body works, of how perfect it is, and how it's always optimizing, it's always adapting, it's always getting better. And I love this quote from Nietzsche: there is more wisdom in your body than in your deepest philosophy. And I just feel like that is the absolute truth, is that there is so much wisdom. And, the 5 biological laws is I just think just getting into understanding the body in this deeper way, understanding ourselves, understanding nature. And I just think it's wonderful, and it takes the fear away. And that's the thing I wanted you to get from this presentation is, a glimpse into the understanding of what's going on. And then just that, I want you to relax. I want you to realize that your body is working for you, that it's helping you. And so if you need any type of coaching, if you like me to work with you on this so we can talk through things, that you can learn to understand, how you view the scenario, what's going on, what stage are you in, what symptoms do you need to be prepared for, how do we prevent this from happening again. There are so many different levels to the ways that we can apply this knowledge in our real day-to-day lives. And so I am here for you. I shifted from full-time practice as a chiropractor to doing mindset coaching. And now when I've married it all together, the understanding and knowledge and wisdom of the body that I learned in school, the mindset work that I've done for years now, and then the understanding of GNM and the 5 biological laws have really just allowed me to be able to offer things to my clients and patients to help you have that complete approach to your mind, to your body, and how to integrate it all together. So feel free to send me an email at drmelissasell@gmail.com. You can visit my website, drmelissasell.com, where I have other videos and articles. Please follow me on Facebook, connect with me on Instagram, and this is it. This is the new medicine. And so bear it well, share it with other people. People deserve to know how their body works, and they deserve to be free from fear, and that is my mission. So thank you so much for joining me, and I hope to speak with you very soon.